Hello, all. Do you know what's the most frequently asked question in a rhinology theatre session or a clinic? Every time a freshly graduated medico comes to the OR, they ask, how do you hold an endoscope? Hold it with the left hand? That's so difficult. Well, it is difficult. Nasal endoscopy is a fine, delicate art. This video is my personal opinion on how to hold a nasal endoscope. So here we go. So many people ask this question, how to hold an endoscope? And that's the first thing to begin with. Holding an endoscope is very crucial because, if we are not holding appropriately or properly, we'll have pain not only in our hands, but also at the elbow and shoulder. So first and foremost, that you should be relaxed. This is the endoscope as it is when we are operating. Endoscope, the cable and the camera. The camera is usually covered with a sterile cloth. Okay, so how do we hold this? So remember, now this is a 0-degree endoscope. So you'll have 30 degrees and also 70-degree scope if you need it. So how do you hold it? The whole purpose is you should not put extra efforts to hold it. Don't grab it. Okay? So if this is the camera head, there are different ways of holding it. One is you can just hold it like this. What happens is, let me put it in the proper position. When you're holding like this, there's a gap you can see over there. So I'm not using palm or gap. I'm not holding it like I'm going to stab someone. No. It is a delicate touch. Can you see this? Okay? So hold it this way. You can keep your finger over here or over here, everything above the cable, or you can hold it this way as well. I'll tell you what are the drawbacks if you hold it this way. The second way of holding is, some people like to hold it this way. So I'm putting the endoscope on this and supporting the weight with a thumb. So the patient is lying down, you go like this. Okay? Now, the third way of holding, as you can see, is also just 2 fingers above and the remaining 3 fingers underneath. The benefit of that is you're getting the weight distributed. Some people do hold the endoscope this way. I mean, personally speaking, I find it difficult because when you're holding it this way, the weight of the camera comes down. You can see how my thumb is getting all the weight. Whatever way you are holding it, the main idea is to keep this joint on neutral position. Keep it in neutral position. So when you're holding the camera and if your wrist joint is extended or flexed, it's a wrong position because it will start hurting. It will actually pain a lot. You may develop ganglion as well. If you're holding it too tight, like I'm stabbing someone, you start having cramps on this part. Now obviously all this method is for someone who is right-handed because it's the left hand where we are holding the scope. For someone who is left-handed or ambidextrous, it's quite easy for them. The next thing is, as I was saying, this light cable coming up. Which is the position that you want to keep it? Coming from top, coming from side, coming from bottom, coming from the other side. This looks quite sensible, right? Quite sensible. There's no kinking around. But what is the problem? Imagine you're operating, there's a patient over here. This is the head of the patient. And This is the nose and we are going like this. What is underneath the nose? Mouth and an ET tube coming out. Okay? The endotracheal tube which is coming out, this thing can hit the tube and unknowingly we can either dislodge it, pull it out, or we will struggle to go properly because there is a hindrance from here. So the other way is keep it on this side or that side. You can hold it this way or hold it this way. In this, the tube gets supported over here. Some people say that by this, the tube gets very heated because of the light illumination and you may experience some heat trauma. I have not personally experienced that. The other thing is coming from up. You can do that as well. But there can be some kinking. Some people have some support where it doesn't get kinked. I believe on the right or left horizontal is a good position. Again, everything depends on your comfort level. If you are doing, the patient is flat on the table and you are operating like this, in that way, the tube coming from south is better. But our practices, we like to operate on at least 20 to 30 degrees elevation and the neck is slightly flexed. We know that most of the bleeding from nose surgery is the sinus bleed, and keeping it elevated gets the venous pressure down. Last thing, this is now a 0 degree endoscope. Imagine if you are using angled endoscope. We go inside, we are going inside with this 0 degree, this is the view we are getting. If we are using angled scope and if this is the view, if we want to look up on this side or look up, what do? We have to change the angle of the scope. So the best way is you hold this and turn it around. Try it next time when you're holding. The view of the scope changes. So you don't need to change the camera. You see? Just hold it like that and turn the cable around. So for this purpose, if I am holding the scope this way, I cannot take it down. I can pull it up but not down. So in this case, holding the endoscope on the camera is very good when you're using an angled scope. You can move around freely. You see? Ultimately, the main thing is that you should not have cramp when you're holding, after holding for long. Then it should not hurt and you should not get pain on the elbow and shoulder. For that reason, when you're again doing the surgery, it should be in the neutral position. It should be neutral, not too high, not too low, neutral position. You won't have any problem. Okay? There you go. Thank you.